Hello, everyone. I'm Dr. Maryam Lustberg, and I'm very happy to speak to you today about metastatic survivorship. I will share my slides and put it in presenter mode. Great. So our topic today is metastatic survivorship care. What is it and how can we improve it? I'll start out with two clinical vignettes to give all of us a flavor of the various survivorship issues that are faced by those who are living with metastatic, advanced, or incurable cancers. And you will see those terms being used interchangeably throughout the talk. We'll focus on some definitions and current status, and then spend some time talking about different opportunities within the field of cancer survivorship and how they may specifically pertain to those living with advanced cancers. So starting with clinical vignette 1, this is a 56-year-old woman who was diagnosed with stage 4 HER2 overexpressing breast cancer 5 years ago. She was treated with 6 cycles of chemotherapy in combination with HER2 antibodies. And for those of you who know breast cancer, these included Herceptin and Perjeta, also known as trastuzumab and pertuzumab. She responded very well, thankfully, and as a consequence, chemotherapy was able to be stopped, but her HER2 antibody infusions continued indefinitely, continued every 3 weeks. So every 3 weeks, she has to come to the infusion center, have approximately 2 hours of therapy for these HER2 antibody drugs. She has scans every few months, and so far her breast cancer is under good control. Focusing a little bit more on the various survivorship issues that are faced by this patient, these include psychosocial oncology issues, including fear of cancer progression, even though things are going well, and the anxiety produced by scans that come periodically. She's had some physical toxicities as a consequence of her therapy, including cardiac damage from her HER2-directed therapy. And this was picked up by serial echocardiograms that showed a recent drop in her ejection fraction. So her oncologist has recently referred her to a heart specialist. And they will work collaboratively in terms of how to optimize her cardiac health so that she can get back on these therapies. Chemotherapy also has led to additional physical effects of numbness or tingling, also known as neuropathy. And this is uncomfortable, flares up, and she is always looking for additional strategies on how to improve these symptoms because so far things have not been effective. She's also unsure of what exercises are safe to do with her history of bone metastasis. Can she only walk? Can she lift heavier weights? These are some of the questions she has, and her oncologist is not always clear on what is absolutely safe for her. And then her primary care provider is also excellent, but she's also not as clear on what health promotion measures to focus on for this patient living with metastatic breast cancer. Does she still need mammograms? Does she need a colonoscopy? And what vaccines are safe with her history of active cancer? Clinical vignette 2 touches on a few additional themes. This is a 60-year-old man who's been living with metastatic prostate cancer for a couple of years. He's on hormonal therapy with androgen deprivation therapy, and his most recent scans also show stable bone metastases. So from a cancer standpoint, he's doing well. However, he's experiencing a series of sequelae that are the consequence of the cancer and the cancer therapy. These include sexual dysfunction, fatigue, the cancer, as well as some of the physical effects have impacted his relationship with his wife. And so she and this patient are considering potentially seeing a counselor. However, they're looking for someone who is more familiar with the unique issues that are faced in relationships in the context of ongoing cancer care. His primary care provider is also excellent. However, because of the androgen deprivation therapy, his high blood pressure and cholesterol issues have been a little bit harder to manage. So there has been ongoing dialogue with his oncologist and primary care provider in terms of how to optimize these. So I hope those two cases gave you a flavor of some of the survivorship issues that are faced by patients living with cancer, and I'm sure you have additional concerns. And I hope as the talk progresses, you get additional ideas about how vast this field is and how there are so many opportunities where we can do things better. So in terms of the definitions, quality of life is very central to survivorship care. And the most important aspect of it is, what does it mean to you? The official definition is the perceived physical and mental health over time, and it can include both positive and negative aspects of life that go well beyond health. So our physical symptoms are only one component of our quality of life. What is cancer survivorship? So there's a lot of confusion about who is a cancer survivor and what is cancer survivorship. And the National Cancer Institute definition is an individual is considered a cancer survivor from the time of diagnosis through the balance of his or her life. So it's a very inclusive definition and clearly includes those living with metastatic breast cancer, with metastatic cancer of all kinds. As we think about cancer survivorship, it is a very broad area with multiple domains that include surveillance for progression of disease or recurrences, physical effects, psychosocial effects, health promotion, and chronic conditions. And I think the two cases that I highlighted show that all of these domains are very intimately impacted in those living with advanced cancers. And these can impact healthcare, health-related quality of life, healthcare resources and delivery of care. Certainly, we're much more in tune in terms of financial toxicities of our treatment, as well as how all aspects of survivorship care can also ultimately impact mortality. So how are survivorship programs currently doing nationally? In Table 1, you can see the range of services that were polled from web resources of survivorship programs, and nutritional services were the most common. Description of what we call a care plan, where cancer and cancer treatments to date are summarized, are up there. And then you can see that some other important services are not always very commonly provided. Psychology services are just provided by a little over half of the programs. Physical activity programs are only a third of the patients. Financial support services are in the minority of the programs. And most importantly, when we actually look at what is described in these websites about the target population of survivors that these programs are targeting, you can see that at least in the websites, the majority of the advertisement for these programs is for patients who are after treatment or they have completed their treatment. And obviously, this does not resonate with many patients living with metastatic cancers because their treatment is ongoing. So this really highlights one of the gaps in survivorship care, which is that metastatic patients have been unintendedly excluded from certain survivorship research and programming initiatives. And Many survivors talk about the bell, ringing the bell after treatment ends. Well, what happens to those survivors whose treatment is ongoing and does not end? So that in itself can trigger a lot of complex feelings about what it means to be a cancer survivor living with an incurable type of cancer. And adding to this, the term itself may not resonate with all patients, and some patients living with advanced cancer or even with curable cancers may not like the term survivor. So it's important to know that the label itself can be anything you want or don't want. However, what I hope to share with you in the coming slides is that the survivorship needs, all the domains that I highlighted in the previous slides, those are things that are so important for quality of life and optimizing healthcare related outcomes. And whether you're diagnosed with early stage cancer or diagnosed or progress to metastatic cancer, there's a lot of needs. There's a lot of living for patients who have ongoing care for metastatic cancer. And our opportunity is to do a better job of addressing those symptoms. So one area of opportunity is health promotion, and health promotion is a key feature of health optimization, and by definition includes screening, focusing on diabetes, hypertension, and hyperlipidemia. And as you saw with our case number 2, he had issues related to these, partly as a consequence of his cancer treatment. Cancer screening, this needs to be tailored to the prognosis and the disease status, and I'll talk a little bit more about that in the next slide. Lifestyle behaviors are just as important in the advanced cancer setting, and that includes smoking, alcohol, and some protection habits. Weight management can, depending on the type of cancer and the type of advanced illness, many patients actually can gain weight during certain treatments and others can lose weight. So this really has to be tailored. Vaccines are certainly important, especially since patients on ongoing treatment can be immunosuppressed, and certainly screening for exposure to different infectious agents. These are all parts of health promotion, and I hope it's clear that all of these are just as important in the advanced cancer setting as they are in the early stage setting. And the most important takeaway is that health promotion does need to be personalized in the advanced care setting, and it's a really key partnership that has to be optimized among patient, primary care provider, and the oncologist. And all individuals need to be aware of different metabolic changes and cardiac risk factors that can happen as a consequence of our treatments. And it's really important that cookie cutter approaches don't really apply always here, and we have to match screening and testing guidelines to each patient and disease status based on how the cancer is doing, what the life expectancy is, and to do the screening test that makes sense, and to be able to leave behind things that may not make as sense in that current disease status. And improving lifestyle factors, increasing physical activity, stopping smoking, all those things are generally beneficial to most patients and in most disease states within reason. Just recently, the American Society of Clinical Oncology updated their guidelines on exercise, diet, and weight management during cancer treatment. And they reviewed over 52 systematic reviews and an additional 23 randomized trials. And the most commonly studied cancers that were featured in these studies included breast, prostate, lung, and colorectal cancers. And the findings showed that exercise during cancer treatment led to improvements in cardiorespiratory fitness, strength, fatigue, and many other patient-reported outcomes. However, based on the available data, the evidence for dietary and weight loss interventions was much more limited. The guideline was good to mention that exercise in individuals with advanced cancer was important. However, there was a critical need for more research in this area, particularly regarding diet and weight loss interventions during cancer treatment. And there was a little bit also less robust evidence for exercise interventions in the advanced setting. That does not make it any less important. However, highlights again some of our gaps in survivorship research where in years prior, not enough attention has been focused on those with metastatic cancers, and this is absolutely changing, and this is a priority of many cancer funding agencies and many cancer researchers. So kind of building on that, exercise is absolutely an opportunity where we need to optimize and really tailor our recommendation to each patient living with advanced cancer. And the benefits are tremendous in terms of strong data for fatigue reduction, improvement of symptoms from cancer and other cancer treatments. And one area that we absolutely need to continue to educate our healthcare workers as well as our patients is how to safely recommend exercise as a prescription, particularly in patients with bone metastases. And as I mentioned, the benefits are high with improved quality of life and fatigue and improved mental health. And the good news is that the majority of oncology health professionals do believe that physical activity is important and safe, but they do want more information about how to safely recommend it in a patient with bone metastases. So this is an opportunity for additional implementation and implementation type research. An additional area of opportunity is related to symptom management. We have lots of new therapies, a lot of targeted therapies in all cancer types, and some of them have better toxicity profiles, but others have newer side effects and newer toxicities. And so we're just beginning to learn how all of our therapies can really potentially impact every part of the body, as this schema by a patient advocate here shows. Essentially, these could be head to toe symptoms, as many of you are probably experiencing. And so patients are leading the way in terms of how we can optimize symptom management in cancer survivorship. And one area that has emerged is that perhaps we've adopted too rigid a view on drug dosing, and that we need to really look at how we dose drugs, how we dose reduce, and how we talk to patients about symptom toxicities in advanced cancers. So this was the patient-centered dosing initiative. That was an advocate-run initiative, and majority of patients, over 86%, are having a bad side effect in this particular population. It was metastatic breast cancer, and their side effects have led to emergency room visits and have led them to miss certain treatments. And in terms of the range of treatments, even targeted therapies had side effects, even endocrine or hormonal therapies had side effects. So really any treatment that we prescribe for cancer can be associated with some symptom toxicities, and the most common side effects included fatigue, nausea, low counts, neuropathy, and diarrhea. And you can see the list of other issues that are listed. So this is part of the physical effects domain of cancer survivorship, and that part of optimizing healthcare-related quality of life and improving the symptom experiences for us to be aware of these side effects and to take interventions. And one of the ways that we can mitigate these toxicities is by lowering the dose, prescribing additional medications to manage these, providing suggestions, and even in certain situations, changing treatments or referring to additional specialists who can manage the toxicity better than we can as oncologists. An additional opportunity is related to psychosocial oncology and mental health. There are multiple areas where in this particular survivorship domain that do impact those living with advanced cancers. This include fear of recurrence and progression, adjustment to a new diagnosis, awareness of prognosis, navigating relationships with family and loved one in the setting of an advanced illness, legacy work, as well as finding meaning in the setting of living with a chronic condition that in many patients can progress and in many can ultimately be associated with additional symptom burden and ultimately end of life. So the awareness of all these can have tremendous psychosocial impact on many patients and families living with advanced cancers. And lots of studies in this area, including, for example, this study where they looked at patients living with metastatic lung cancer. And they asked patients kind of what was important to them and what types of psychosocial needs that they felt needed additional addressing in their care. And there was a resounding need for comprehensive cancer care that included psychosocial support. So patients don't want only their physical symptoms to be focused on. They want their psychosocial and mental health needs also addressed as part of comprehensive oncology care. They want to have additional communication about how to prepare for the future. And they wanted the opportunity to communicate about how to clarify and understand their goals of care. There was interest in peer support and interacting with other patients with similar diagnoses. And just the need for additional support related to uncertainty that all of us face as humans. However, it becomes much more front-end focused when living with advanced cancers. And so the question is, how do we deliver this type of support? The traditional model is through one-on-one support with a trusted psychologist or counselor or social worker. However, resources can be limited in certain centers, and these persons may not be as readily available. So there are lots of efforts in terms of, are there other ways where we can deliver this type of support, including using electronic apps or web resources, where perhaps in the comfort of your home, you can have access to this extra level of support. And the study I'm highlighting here was conducted in Australia, and it took patients with metastatic breast cancer, and it tested the experience of an online support module. And based on feedback from patients, they actually did not like one of the modules being labeled cancer survivorship. They actually wanted it labeled as unique challenges of living well with metastatic breast cancer. So again, this comes back to labels. The label itself is not as important. I think it's important for us to be sensitive in terms of what patients want to be called and what they want their programs to be called. However, the need for psychosocial support, which is a key domain of cancer survivorship, was resoundingly clear here. And generally, patients had very positive feedback to the experience of using this online resource, and they would recommend it to others. There's also additional opportunities in cancer survivorship, whether in early stage or advanced cancers, to really improve diversity and inclusion. And unfortunately, most of our cancer trials have suffered from lack of diversity, and this is not unique to cancer supportive trials and cancer survivorship trials. And so we do understand that there are absolutely disparities in terms of access to survivorship services and access to cancer supportive care services. In this study, near the end of life, there was actual disparities in use of supportive care medications, which during a particularly emotional and challenging time for families and patients, the level of support that patients were receiving was different. So this area, it deserves a lot of attention and improvement, and this is an additional focus area by the National Cancer Institute to really look at equity and access in survivorship services, no matter what the stage of cancer. And this is an area that we all feel needs improvement. This is an area that absolutely needs to improve as soon as possible in the coming years. So in conclusion, giving you a snapshot of metastatic survivorship care, and I think it's time to do better, have more inclusive studies, more inclusive programs. When we look at the needs of survivors with metastatic breast cancer, multiple domains can be affected in survivorship, including physical, emotional, sexual, chronic illnesses that can happen, financial concerns, which I did not delve into in detail in this talk, care coordination, just how do the different specialties and primary care providers are interacting, impact on families and caregivers. So in this table, you can see how both survivors with early stage cancer as well as survivors with metastatic with metastatic cancer can have very different needs, but the domains that are affected in cancer survivorship, these need to be addressed for both groups. And I think as a community of oncologists and survivorship researchers, we're committed to providing this care. And as we think about how to deliver metastatic survivorship care, I think it's really important to think about care coordination with oncology, primary care, and other specialists working together closely. And there's a lot of new resources, including a program that I'm very excited about called Project Life. This is focused on metastatic breast cancer, and I hope it grows to other cancers, where at no cost, survivors living with advanced cancer can sign up and have access to a number of peer support, peer mentoring, different free programs that focus on different aspects of survivorship. There's growing attention to metastatic survivorship. There was a workshop by the National Cancer Institute back in last May, where researchers and thinkers in this area came together to really address the many existing gaps in metastatic survivorship. And this has led to now an issue for proposals for researchers to put their best research forward in terms of understanding and addressing the survivorship needs of individuals living with advanced cancer. And the Journal of Cancer Survivorship devoted a whole series to cancer survivorship in the metastatic incurable cancer setting. And I will end with the words of the patient advocate who was very involved in the design of this section. I will read her words, which was featured in this editorial as an opening to this section. While cancer survivorship is defined as starting upon diagnosis, inclusion of patients like me in research program offerings discussions has not yet matched the definition. We're not automatically included in any of it. Sometimes I'll hear that survivorship research is important for those with incurable cancer because more people are living longer. But the fact is that everyone, even those survivors not beating the survival odds, deserve to have their needs seen and addressed. It's time to leave behind the arguments I've heard as someone living with metastatic cancer that people with incurable cancer are inevitably going to die soon, are physically incapacitated, have too many problems that make including them too difficult, and the payoff is less evident because there are fewer of us. These are the words of Martha Carson, a patient advocate, who I think very wonderfully summarizes the call to all of us to focus on metastatic survivorship. We need to better address our needs, and we all hope to partner with all of you. So continue to share your concerns, needs, and I think it's time to do better. Thank you so much.